You know, a tiny clip is having a huge impact on the lives of dozens of heart patients in the Ottawa area.
It's called the MitraClip, and doctors at the University of Ottawa Heart Institute were among the first in Canada to use this life-saving device for leaky mitral valves.
Everybody ready?
It's a crisp, clear day, and Marina Murray and her family are taking it in.
I'm hanging on, I'm not letting him walk ahead.
A simple walk that just a few months ago would have been too much for this normally active grandmother.
Well, I couldn't go past 2 houses, I guess, but I was like, okay, I gotta stop, catch my breath. Schlante.
Short of breath, tired all the time. Symptoms this 76-year-old had had for some time because of a condition called mitral regurgitation. The mitral valve in her heart was leaking.
When that valve, the mitral valve, gets damaged, it begins to leak. And that leak can be torrential, so the blood is regurgitating back into the lungs and people are left breathless, short of breath, fatigued.
The blue in this animation shows how that blood backs up into the top left chamber of the heart. The condition is most often repaired through open heart surgery, but some patients simply aren't strong enough to survive that. After 3 heart attacks, 2 triple bypasses, and 2 heart failures, Marvin Blauer was worried about having his chest opened again to repair his mitral valve.
Marvin, how are you?
I'm good, Doc.
Great to see you.
But cardiologist Dr. Marino Labinaz was a step ahead of him.
He knew what I was thinking very quickly, and he said, I'm not going to operate. We can do something else, and it should work.
That something else is called a MitraClip. Dr. Labinaz was among the first in Canada to use it.
So what this MitraClip does, it is a novel technology that we can insert using a catheter, which we advance through the veins of the leg up to the heart. And we use this clip to bring the 2 leaflets of the valve together and help reduce the leak.
With the heart still beating, the MitraClip is delicately positioned directly over the leak, then clipped onto both sides. It's a complex surgery that takes incredible dexterity.
If we're off, say, half a centimeter, it doesn't work. If we don't grasp both leaflets, it doesn't work. If we get caught into the cords that attach to the valve, we can cause a catastrophe.
Dr. Labinaz and the team at the Heart Institute have now performed more than 50 of these procedures. They are reserved for the sickest of patients who have no other options. Recovery is a few days, compared to possibly months with open heart surgery.
The goal is to reduce not only the burden to the patient, but also to the healthcare system with this clip, because it reduces the time spent in hospital and improves the life of the sickest patient who spends many recurrent stays in hospitals.
For 74-year-old Marvin Blauer, it has given him strength, both physically and mentally.
And what's important for heart patients is that you got the confidence back in your body. You can go about your life and stop worrying about it.
For Marina Murray, she says doctors at the Heart Institute have given her back her energy and her enjoyment in a simple walk with her family.
But once this was done, I couldn't believe the difference. I just sort of, oh, I don't feel tired anymore, you know. I actually, gee, is this the way I used to feel? There's no comparison.
For the University of Ottawa Heart Institute Telethon, I'm Joanne Schnur.